Hi, Dr. Tracy Tyson here. I'm a board certified general pediatrician in Vermont, and I'm on a roll today. If you can't tell, there's a lot of videos with the same outfit on, but obviously I have a lot to say, and these are the days that I have time to do it. So one of the things that I didn't understand as a patient, and then I hear a lot of people talking about, and for very good reason, is why is your doctor always running behind? I think that's a really good question and something relatively fun to talk about and without a lot of controversy. So in primary care, we are scheduled appointments at a very specific time. In my office, we're anywhere between 15 to 20 minutes. Some of the providers are still 15 minutes, but we try to keep it to 20 minutes. That's for all visits. And that's 20 minutes from the time you're supposed to walk into the door until the next patient is supposed to walk in the door. So that includes you walk in, you check in, the front desk asks if your insurance information has changed, collect payment from you if that is needed, ask if you need any forms filled out that day, give you forms to fill out while you're waiting. That's the medical assistant then grabbing your child from the waiting room, bringing them back, getting their vitals, height, weight, blood pressure, sometimes oxygen level in a child who is fighting them and not super excited to be there, asking about any medical history, medications, going over some of the developmental milestones. Are they walking? Are they talking? How much are they eating? Do you have any questions or concerns you want to talk to the doctor about? And then the doctor comes in and has reviewed all that information for a quick second, but a lot of times is walking right out of the other room, walks in, tries to establish some rapport, tries to talk about things, and is always running behind. A few big reasons why we run behind that are related to things that patients have control over. And I'm saying this is the pot calling the kettle black. There's no judgment. But when you show up late to an appointment, when you show up late, your appointment time is actually with the front desk person, not necessarily the doctor yet. So when you show up late to the front desk, then you're already kind of starting off behind and you're eating away at the time that the doctor has to see you. If you don't have your insurance information with you, if you didn't do paperwork ahead of time, doing paperwork ahead of time can be really, really helpful, especially now with the portal. We send out a lot of screeners that can be done at home. We actually do review those before you come in, by the way, so those are really helpful for you to do ahead of time because it saves us reviewing those right when we're walking in the room, or what happens a lot with me is they're not filled out by the time I come in the room, so then I'm having to look at them when I'm in the room, or sometimes after you leave and then go, oh, I need to call this family back about this. So those are things you can do as a patient to be on time. But when you do all those things and we're still running late, it doesn't feel good. So I'll tell you some other reasons why we might be running behind. Especially in pediatrics, we don't have a big rule that you can only talk about one thing. We don't have a rule that if you come for a wellness visit and your child has an ear infection, that we're not going to treat the ear infection. These are children. They have same-day issues and they need to be addressed. And the point of some of these wellness visits are to actually screen for problems. So when we find problems, we have to talk about them. If your child screens positive for depression, I'm not going to just say, oh, well, I'll talk to you in a few weeks. We have to talk about it then. Sometimes I have to ask you to leave the room, talk to the child privately, find out what's going on. Sometimes I have to get blood work. Sometimes I have to get a urine test. We do a screening test at 1 and 2, which I'll talk about those as well, where we check for hemoglobin for iron deficiency anemia and lead exposure. And what if those are positive? We have to talk about those and provide treatment. And sometimes the nurse has to come back in. Sometimes I then have to come back in. And then sometimes there's an emergency where a child comes in and we did not realize how sick they were if it was for a sick visit. And we have to do a breathing treatment, and then we have to go back in and reassess. And sometimes I've given up to 3 breathing treatments in the office, having to go back. Each breathing treatment takes 8 minutes. So it's 8 minutes to sit there for the breathing treatment, go back in. Those patients are still only given 20 minutes. Pediatricians don't have time to see patients a lot slower than that. There are some areas where they might be at 30 minutes, but it's really rare to go past that. So when we are running late for your room, especially if it's a pediatrician that you know and trust, and you know that is not just wasting your time, we're not in the break room hanging out, we're not doing stuff for fun. We are usually addressing a need of another patient, and hopefully you don't have that same need, but if you do, we will stop and we will provide it. Another thing that happens is there is no built-in time during the day to go over labs that you've ordered. You have to do that in between patients. So if labs are coming back or x-rays, If the nurses who are answering the phone have questions for you, they send you a message on your computer, and some of them you have to answer right away. They can't wait till the end of the day. Refills for medications, a lot of times children's refills for medications, we say 3 to 5 business days, but most of the time we refill those same day because we know what it's like to be waiting for them. And if your child is out of albuterol, we know that that needs to be sent in as soon as possible. Also, if a specialist calls me back, if I've had to talk to them about a child's stomach and I have to talk to a gastroenterologist, I can't talk to them past 4:30 in the afternoon most of the time. If it's an emergency, of course I can. But so if they have to call me, they have to pull me out of a room. I have to talk to them. Sometimes then I have to relay a message back to the nurse. So there's a lot of kind of moving pieces that are going on. And honestly, families are so patient about this. And I've been the patient in the waiting room feeling like, oh my gosh, what's going on? Why am I waiting so long? But I just wanted to kind of like explain why this might happen. And if you see your pediatrician running around like a crazy person, hopefully this will make a little bit more sense. And if we all work together, we can try to stay on time a little bit more. And like everything else, if it's something that's really important to you and your pediatrician is someone who is never on time, say something. I actually really like it when families tell me what the issue is. There are some things that are my personality. I can't do anything about that. I'm not going to be a different person, and nor would they want me to be. But if there's someone at the front desk that they need to tell me about, if they don't like the way that, a staff member talked to them, or how something works, or how I handled something, if I didn't call them back in a timely manner, or if they did have to wait on me, I might have a really good reason, but I'd rather you ask me than assume the worst. So again, trying to have some transparency. Let's talk like human beings. Let's talk like people to each other. Everyone's just trying to do the best that they can. And hopefully this helps and we can all get through our appointments with less stress. Bye.